I have here is the transverse section of spinal cord. And as you can see in the middle, there's a butterfly-like shape. This shape is actually composed of the gray matter of spinal cord. That is, all the cyton or the cell bodies of the neurons present in the spinal cord are gathered in the middle, forming this butterfly-shaped gray matter. The gray matter of the spinal cord contains a dorsal horn. It contains dorsal horn and ventral horn. Just so you are not confused, this is the dorsal side and this right here is the ventral side. Okay. From the spinal cord arises two roots. One arises dorsally, which is called the dorsal root, and the other arises ventrally, which is called the ventral root. So this is the ventral root and this is the dorsal root. The dorsal root contains something called a dorsal root ganglion. This right here is the dorsal root ganglion. The dorsal root and the ventral root, they fuse with one another to form a trunk. The trunk further divides into two. This right here, present dorsally, is the dorsal ramus. And this right here, present ventrally, is the ventral ramus. Now you might be wondering, what's the point of knowing all this for a topic like brachial plexus? Well, the importance lies in this structure right here, called the ventral ramus. The ventral ramus is important because it is the ventral ramus arising from the spinal cord that is responsible for the formation of various types of plexuses that exist in our body, like the cervical plexus, the brachial plexus, lumbar plexus, sacral plexus. All of them are formed from the ventral ramus arising from the spinal cord. This brings us back to the question, what exactly is a nerve plexus? The word plexus means network and nerve plexus refers to a network of nerves. Brachial plexus is obviously a nerve plexus. And the important topic under brachial plexus is the anatomy of brachial plexus, or how exactly is brachial plexus formed. But before getting into it, there are a few things that I want to share about brachial plexus. First thing, this network or meshwork of nerves that you see is the brachial plexus. And brachial plexus is responsible for supplying to your upper limbs. So basically, brachial plexus innervates upper limb. Anatomically, the plexus is found sandwiched between two muscles, and they are the anterior scalene muscle, which is present in front of the brachial plexus, and the middle scalene muscle, which is present behind the brachial plexus. This right here is the anterior scalene muscle. Here's the brachial plexus, and behind it is the middle scalene muscle. This is the other point of view for the same. So here's the anterior scalene muscle. This is the anterior scalene muscle. Here's the middle scalene muscle, and posteriorly is present the posterior scalene muscle. In between the anterior scalene muscle and the middle scalene muscle is present the brachial plexus. Which parts of the brachial plexus? You can see the roots as well as some part of the trunk of brachial plexus present sandwiched between the two muscles. And what exactly are roots and trunks of brachial plexus? That's exactly what you are going to learn now. Let's look at the formation of brachial plexus. We know that brachial plexus is formed from the primary ramus of spinal nerves arising from segments of spinal cord. But the question lies, which spinal nerves are involved in the formation of brachial plexus? And the answer is C5, C6, C7, C8, and T1. So what we have here are segments of spinal cord. This segment gives rise to C5 spinal nerve. This segment gives rise to C6 spinal nerve. This segment gives rise to C7 spinal nerve. This segment gives rise to C8 spinal nerve. And this segment gives rise to T1 spinal nerve. This right here is the dorsal root of the spinal nerve, and this is the ventral root of the spinal nerve that merge to form the trunk. And the trunk again splits to form a thinner dorsal ramus and a thicker ventral ramus. The ventral rami of C5 spinal nerve, C6 spinal nerve, C7 spinal nerve, C8 spinal nerve, and T1 spinal nerve are responsible for the formation of brachial plexus. This is a normal brachial plexus, but there are other types of brachial plexus where the segments involved or the spinal nerve involved, it shifts by a level up or a level down. They are: number 1, prefixed type. In prefixed type of brachial plexus, it's the C4 spinal nerve which contributes in the formation of brachial plexus, and the contribution of T1 is negligible. Second is postfixed type. In postfixed type, it's the T2 spinal nerve that is responsible in the formation of brachial plexus, and the contribution from C5 is negligible. So there's your number 1, normal brachial plexus, which is dominantly found where the spinal nerves C5, C6, C7, C8, and T1 contribute in the formation of brachial plexus. If there's a shift 1 up, that is C4, and T1 is negligible, then that's your prefixed type. If there's a shift 1 down, that is T2 contributes and C5 is negligible, that's postfixed type of brachial plexus. The brachial plexus contains various parts, or the brachial plexus for the sake of study has been divided into various parts, and these various parts have been represented using various colors in this particular diagram. So you have roots, trunks, divisions, cords, and branches. Firstly, there are the roots. Roots are nothing, I repeat, roots are nothing but primary rami. Primary rami. See, let me revise you this thing. At the very beginning, I said that the spinal nerve contains ventral root and dorsal root. So the root of brachial plexus is not to be confused with the root of spinal nerve. The root of spinal nerve are the ventral root and dorsal root, or the motor root and sensory root that fuse to form the trunk. And this trunk splits into ventral ramus and dorsal ramus. This ventral ramus right here of the spinal nerve is actually the root for brachial plexus. So the roots that you see in this particular diagram, these roots are nothing but the ventral ramus arising from respective spinal nerve. So it's shown here C5, right? It refers to spinal nerve C5. So the ventral ramus of spinal nerve C5 is this, which is a root for brachial plexus. Okay, concept clear? Primary ramus is the same as root. Root for brachial plexus is the same as primary ramus. Fine. So see, roots, they fuse to form trunks. Trunks bifurcate to form divisions. These divisions again fuse to form cords. And these cords, they again divide to form many branches. However, branches, they don't just arrive from cords. There are branches arising from cords, there are branches arising from trunks, and there are even branches arising from roots. So there are three types of branches that you need to know. Those arising from cords, those arising from trunks, by trunk I really mean the upper trunk, and those arising from roots. The mnemonic for you to remember all these parts is rugby team drinks cold beer, where R stands for roots, T stands for trunks, D stands for divisions, C stands for cords, and B stands for branches. One last time, you have roots, which is the same as primary ramus, that fuse to form trunks, that split to form divisions, that fuse to form cords, that give off various branches. Branches can arise either from cords or trunks or roots. Now I'm going to draw the whole thing, and this diagram which I'm going to draw is the one that you have to draw in the exam as well. Remember, rugby team drinks cold beer. Roots, trunks, divisions, cords, and finally branches. So first we got the roots. Roots arise from C5, C6, C7, C8, and T1 spinal knobs. So these are the roots, which is basically the primary rami. The roots of C5 and C6 fuse, and the roots of C8 and T1 fuse as well. And then they give trunks. This is the upper trunk. The C7 root extends to form the middle trunk, and then this is the lower trunk. These are trunks. So we have the upper trunk, middle trunk, and lower trunk. Trunks, they again bifurcate to give divisions. So we have upper trunk that give a posterior division and an anterior division. This is anterior division. This is, let's say, ventral and dorsal. Give a ventral division and dorsal division. Okay, ventral division and dorsal division. Again, the middle trunk also gives a dorsal division and a ventral division. Ventral division. Finally, the lower trunk also gives a dorsal division and a ventral division. The dorsal divisions are present behind the ventral division. The dorsal division of all three trunks, the upper trunk, the middle trunk, and the lower trunk, they fuse to form a single cord. The ventral division of the upper trunk and the middle trunk also fuse to form a single cord, while the ventral division of the lower trunk, it extends to form a single cord. So what did we have in green? We had divisions. The dorsal divisions of all three trunks fuse to form a cord. The ventral divisions of upper and middle trunk fuse to form a cord, and the ventral division of lower trunk extends to give a cord. So these three are cords. We have a lateral cord, a posterior cord, and a medial cord. The name of the cord is based on their position around the axillary artery, because the three cords are found surrounding the axillary artery, and depending on where they are with respect to axillary artery, they have been named lateral, posterior, and medial. As you can see in this diagram, you have the lateral cord, which is present lateral to axillary artery. we have the medial cord, which is present medial to axillary artery, and we have the posterior cord, which is present behind the axillary artery. So based on the position of the cord with respect to our axillary artery, they are either lateral, posterior, or medial, the three cords. Now there are branches. There are three types of branches. There are branches arising from cords, there are branches arising from trunks, and there are branches arising from roots. First, let's look at the branches arising from roots and trunks. First, let's look at the branches of the roots. From C5 root arises a branch which is called the dorsal scapular nerve, and it supplies to your rhomboid major and rhomboid minor muscles. Second, from C5, C6 and C7 roots arise branches that fuse to form a long nerve which is called the long thoracic nerve or the nerve of Bell, and this nerve supplies to serratus anterior muscle. Next up, we have the roots of the trunk. Among the three trunks, upper trunk, middle trunk, and lower trunk, it's only the upper trunk that gives off branches, and they are: number one, the suprascapular nerve, which supplies to your supraspinatus and infraspinatus muscles. Second, there's your nerve to subclavius. Nerve to subclavius, which supplies to, as you might have guessed, the subclavius muscle. Now there's one thing that you need to know. At this particular point, or at the region of upper trunk, there are altogether 6 different nerves that fuse together. There's the root of C5, the root of C6, the suprascapular nerve, the nerve to subclavius, the dorsal division of upper trunk, and the ventral division of upper trunk. Altogether 6 different nerves that fuse together. And this particular point, where 6 different nerves fuse together, it's called the Erb's point. And an injury to Erb's point leads to something called Erb's palsy or Erb's paralysis, which you'll come to know under clinical anatomy. So what's Erb's point? Erb's point is a point in the brachial plexus at the region of upper trunk where 6 different nerves meet together. And these 6 different nerves are the C5 root, the C6 root, the suprascapular nerve, the nerve to subclavius, the dorsal division of upper trunk, and the ventral division of upper trunk. We also need to know the spinal nerves that are responsible or that contribute in the formation of these branches. For example, in the formation of dorsal scapular nerve, the C5 spinal nerve is responsible. So contribution from C5. In the formation of long thoracic nerve, you have contribution from C5, C6, and C7 spinal nerves. So contribution from C5, C6, and C7. In case of suprascapular nerve, there's contribution from C5 spinal nerve as well as C6 spinal nerve. C5 and C6. The same is also true for nerve to subclavius. So there's contribution from C5 spinal nerve and contribution from C6 spinal nerve. C5, C6. Now let's look at the branches of the chords. There are altogether 3 chords. There's your lateral chord, posterior chord, and medial chord. First, let's look at the branches of the lateral chord. So the lateral chord gives 3 branches. Here's one, here's the other, and then here's another. So there are altogether 3 branches arising from lateral chord. And the mnemonic for the 3 is LML, where L stands for lateral pectoral nerve, M stands for musculocutaneous nerve, and another L stands for lateral root of median nerve. All 3 branches are contributed by spinal nerves C5, C6, and C7. Let me show you how. So first we have the lateral pectoral nerve, which is present right here. So the C5 nerve contributes, the C6 nerve contributes, and finally the C7 nerve contributes to the lateral pectoral nerve. In case of musculocutaneous nerve, which is present right here, the C5 spinal nerve contributes, the C6 spinal nerve contributes, and finally the C7 spinal nerve contributes. And lastly, L for lateral root of median nerve, which is this root right here. It is contributed by the C5 spinal nerve, the C6 spinal nerve, and the C7 spinal nerve. That's how all 3 branches LML of the lateral chord get contributions from C5 spinal nerve, C6 spinal nerve, and C7 spinal nerve. Now let's look at each of these branches one by one. First, L for lateral pectoral nerve. So here's the lateral chord of brachial plexus, from which arises the lateral pectoral nerve. The lateral pectoral nerve branches to supply to the pectoralis minor muscle, as well as branches to supply to the pectoralis major muscle. So the muscles which is supplied by the lateral pectoral nerve arising from the lateral chord are the pectoralis minor muscle and the pectoralis major muscle. For M, we have musculocutaneous nerve. Here's your lateral chord. From the lateral chord arises a branch which pierces through a muscle. So here's a muscle of the arm. This particular nerve, it pierces through the muscle and then supplies down here. This particular branch of the lateral chord is the musculocutaneous nerve. The musculocutaneous nerve supplies to the muscles in front of the arm, which are responsible for the flexion of the elbow joint. And these muscles are biceps brachii muscle, coracobrachialis muscle, brachialis muscle. You can see in the diagram itself, the musculocutaneous nerve first pierces through the coracobrachialis muscle. Then it gives branches to the biceps brachii muscle and to the brachialis muscle. The musculocutaneous nerve then further extends and then supplies to the lateral part of the forearm in the form of lateral cutaneous nerve. Lastly, the last L stands for lateral root of median nerve. The nerve that you see right here is the median nerve, and it is formed when 2 of its roots meet. That is, the lateral root of median nerve meets with the median root of median nerve to finally form the median nerve. The lateral root of median nerve arises from the lateral chord of brachial plexus. So you have the branches of the lateral chord, and they are lateral pectoral nerve, musculocutaneous nerve, and lateral root of median nerve. All 3 of these branches have contributions from spinal nerves C5, C6, and C7. Next up, we have the branches of median chord. So there are altogether 5 branches that you need to know, and the mnemonics for the 5 branches are M, 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 U. So altogether 4 M's and a U. and they stand for the medial pectoral nerve, the medial cutaneous nerve of arm, the medial cutaneous nerve of forearm, the medial root of median nerve, and the ulnar nerve. All these branches get contributions from spinal nerve C8 and T1. So from C8 spinal nerve contributes to the first M, the second M, the third M, the fourth M, as well as the ulnar nerve. The T1 spinal nerve also contributes to first M, second M, third M, fourth M, and ulnar nerve. However, exception lies in ulnar nerve, because ulnar nerve receives contributions from C7 spinal nerve as well. How is it possible? It's possible because of this. See, the lateral cord, this right here is the lateral cord. The lateral cord gives off a branch, which is called the lateral root of median nerve. The lateral root of median nerve communicates with the ulnar nerve with the help of a communicating branch, this branch right here. And through this communicating branch actually passes the fibers of C7 spinal nerve. So if you follow this black line right here, this black line, you'll see that the fibers of C7 spinal nerve, it passes through the lateral cord, and then it passes through the lateral root of median nerve, right? At the same time, it also passes through the communicating branch between the lateral root of median nerve and the ulnar nerve. And this is how the ulnar nerve receives fibers from C7 spinal nerve. And the root value becomes C7, C8, and T1. Now let's look at each of the branches one by one. First M stands for your medial pectoral nerve. So here's the median cord. Here's the medial cord. The medial cord gives off a branch which is called the medial pectoral nerve. The medial pectoral nerve, unlike the lateral pectoral nerve, does not branch to supply to pectoralis major and minor muscle. It instead pierces through the pectoralis minor muscle first and then supplies the pectoralis major muscle. So if you tear pectoralis major muscle and reflect it to see what's present below it, you will be able to see that the median pectoral nerve, this right here, is piercing through the pectoralis minor muscle and finally supplying the pectoralis major muscle. So the muscles which is supplied by medial pectoral nerve are the pectoralis minor muscle and the pectoralis major muscle. Another M stands for medial cutaneous nerve of arm, and the other M stands for medial cutaneous nerve of forearm. So in the arm region, in the medial part of the arm region, it is supplied by the medial cutaneous nerve, and in the medial part of forearm region as well, it's supplied by the medial cutaneous nerve of forearm. And both of these are the branches of the medial cord. The lateral cutaneous nerve supplies to the lateral part of the forearm. And I've already mentioned that lateral cutaneous nerve is nothing but an extension of musculocutaneous nerve. And musculocutaneous nerve is a branch of LML. Which one is it? LML, the lateral cord. Another M stands for medial root of median nerve. So here's the median nerve. It is formed when the lateral root and the medial root, they meet each other. The medial root of median nerve, it comes from the medial cord. The medial root, it passes through the arm in front of the joint, passes through the forearm, and then supplies to majority part of the lateral part of the hand. Finally, you have the U, which stands for ulnar nerve. I've already mentioned the root value of ulnar nerve is not just C8 and T1, it's also C7 because it also receives fibers from C7 spinal nerve. through the communicating branch which is present between the lateral root of median nerve and the ulnar nerve. Finally, we have the branches of medial cord, and the mnemonic for remembering it is ULNAR, ulnar. Even though it does not actually contain the ulnar nerve is present as a branch of which cord? The medial cord, right? Instead, it does contain radial nerve though as its own branch, which you'll come to know soon enough. But here's the thing. The branches of medial cord contains ulnar. That's the mnemonic. Again, not the nerve, the mnemonic, where U stands for upper subscapular nerve, L stands for lower subscapular nerve, N stands for nerve to latissimus dorsi muscle, A stands for axillary nerve, and R stands for radial nerve. Among all these branches, these three, that is the upper subscapular nerve, nerve to latissimus dorsi, and lower subscapular nerve, are responsible for supplying the posterior wall of axilla. And if you don't know what an axilla is or what are the various walls and boundaries of axilla, I recommend you to watch a video on axilla, and I already have a video posted on it in the same playlist. Anywho, so the posterior wall of the axilla is formed of certain muscles, and these nerves are responsible for supplying those muscles, and those muscles are number 1, subscapularis muscle, number 2, teres major muscle, and number 3, latissimus dorsi muscle. Let's look at each of these branches one by one. First, for you have the upper subscapular nerve. So this is the posterior cord. From the posterior cord arises a branch called upper subscapular nerve, and it is supplied to the upper fibers of subscapularis muscle. Next, you have L for lower subscapular nerve. The same cord gives another branch which is called the lower subscapular nerve that supplies to the lower fibers of subscapularis muscle. Along with that, it is also supplied to the teres major muscle. So you have upper subscapular nerve that supplies to the upper fibers of subscapularis muscle, and lower subscapular nerve that supplies to lower fibers of subscapularis muscle as well as teres major muscle. Next, you have N for nerve to latissimus dorsi. Here's the posterior cord which gives a branch called the latissimus dorsi nerve, which is supplied, as the name suggests, to the latissimus dorsi muscle, which is present at the back. Next is A. A for axillary nerve. At the scapular region, there's a quadrangular area. Through this quadrangular space comes a nerve, and this nerve is called the axillary nerve, which is a branch of posterior cord. The axillary nerve gives branches that supplies to two muscles. This branch supplies to teres minor muscle, and these branches they supply to deltoid muscle. It further gives off branches that supply to the shoulder joint as well. Along with that, the skin overlying the deltoid muscle and shoulder joint. So basically, axillary nerve follows Hilton's law. What's Hilton's law? Hilton's law says that if a nerve supplies to a joint, then it will definitely supply to the muscles surrounding that joint. Like in this case, you have the axillary nerve supplying the shoulder joint, so it's also going to supply to the deltoid muscle as well as the skin overlying it. So it's also supplying to the skin overlying it. The axillary nerve has branches that supply to teres minor muscle. It also has branches that supply to shoulder joint, the muscle around the shoulder joint, which is the deltoid muscle, and the skin overlying it. Finally, you have R for radial nerve. The radial nerve, it passes from the back of the arm, and at the back of the arm you have the triceps brachii muscle. So radial nerve supplies the triceps brachii muscle. Then it finally comes in front of the elbow joint and then continues to supply the back of the forearm. And boom, we are done with the branches of medial cord as well. That's it for the anatomy and the formation of brachial plexus. Next video is going to be on clinical anatomy of brachial plexus. So you are going to see Erb's palsy, Klumpke's palsy, winging of scapula, and all that stuff. So bye.